Hi, Constance. This is Tawana, and I am responding to your discussion on common emotional distressors. What I liked about your paper was that you mentioned a lot of people do not trust the process of mental health therapy, sometimes psychiatry. Um, they just don't trust it. And it comes from a history of negative stigma that has been put on individuals and because of the way they treated them, the behaviors. And the most thing that I like what you said was people just don't know what effective mental health therapies can be. In the African American community, a lot of times we didn't understand or was aware of what was happening. We thought this was normal behaviors that they needed either behavioral things like spankings when they were younger, or in the church would bring them in and begin these exorcisms and praying all over them. And I used to, I think this was a big fanfare, but now I understand that the fear of letting people know that you might have these things because of the way they got treated, had lack of medical treatment. Um, they didn't get what they needed in order to get help. So many turned to the streets and alcohol and marijuana and other addictive drugs and being out there sexually and having all these impulses with no one to help and guide them. Colin, 2007, in his book, Christian Counseling, A Comprehensive Guide, publisher Thomas Nelson stated that we need to have support. We need patience. We need to be kind. And we need to just sometimes just be there to be a listener, not to always just try to uh, tell them what to do. Sometimes that don't work. So we give them time and we listen. We should not be in a place now where people are not aware of at least some resources that they can go to get help. And that's why I think it's such a difference from what we used to see. It being strange, their behavior strange. No, now we understand that some of these things come because of biological reasons that may happen in the brain or a history that causes PTSD. And we know now that we can say, hey, there are resources out there for you that can help you. You don't have to, if you don't like this person and the way that they're doing their medical treatment, then you have others and you give them all the resources that you can as a counselor. I work with individuals who suffer, who live because they live well with it, anxieties and depression, bipolar. And the thing is that the main thing they need to know is that they have support, that they have a group of people, a team that is saying, hey, we support you. We understand that you're going through these things. There's not going to be there's not going to be no one method that's going to uh, just make everything all right. But there's numerous methods that can help. And that's what I truly believe. And that's what I like about what this class is showing when you set issues in counseling, because the issues come in the fact that sometimes if you didn't have the right information, you could push people away. It's like multiculturalism. If you don't look at everything that that individual has to deal with in his community, social economics, um, family history. If you don't take all those things in play, you might miss out on what you can do to help an individual. Sometimes the anxiety could come from um, some type of racial problem. And if we don't ask the questions, and if we don't stay informed, we would lose that individual because we haven't been able to tap in what um, would make him a better person and live a better life. Thank you for listening.